Good evening. Welcome everyone to the weekly IMA show. I'm Dr. Ryan Cole, head of medical and scientific affairs here at the IMA. Tonight's topic is an interesting one and very important, and one honestly most doctors don't think about nearly often enough. Your mouth. And, not just for eating food, not just for kissing, not just for saying words. It's not just your teeth, but it's your oral microbiome. It's the ecosystem of the bacteria that live in your mouth that may influence everything from inflammation to immune function to chronic disease and even cancer. And so when we talk about the oral microbiome, we're really talking about the front door to the body. I like to joke that we're just glorified worms. We're open on the front and we're open on the back, and everything from the outside comes in and through, and so we're exposed to so much, and our oral microbiome plays such a big role in health. And it's not just about the mouth, but what leads to other issues in the body from what can appear in the mouth, and that's why it's so important. And I'm very honored and tickled to be joined by someone who I was privileged to meet at the recent IMA meeting down in Dallas. And I'm joined tonight by Dr. Mark Cannon, Professor Emeritus at Northwestern University's Feinberg School of Medicine and Ann and Robert H. Lurie Children's Hospital in Chicago. He's a diplomat of the American Board of Pediatric Dentistry and a former president of the American Academy for Oral and Systemic Health. Welcome, Dr. Cannon.
Well, thank you very much. It's my pleasure to be here. And what we're going to talk about tonight, as you know, is my passion.
Mm-hmm.
That's what I've been working on for a very long time in research and been privileged to work with some of the most innovative people in the field. And I'm retired, hence the professor emeritus, but I am still working.
As busy as
And as
ever,
you
I'm
can
sure.
tell, yeah,
Yes.
with the publications and the research and all that. But yeah, as you said, the no mouth is not just the front door; it's the gateway.
Mm-hmm.
And
And help folks understand when we say, I mean, let's build from the basics here. When we say oral microbiome, what are we talking about?
you're talking about everything in the mouth. The bacteria, the fungi, the viruses, bacteriophages, everything within the mouth that we have evolved with. Over a period of millions of years, as our diet has changed, the climate has changed, our microbiome will adapt, and as it will adapt very quickly. There is a core one, and those core microbiomes are the basis for your immune system.
Hmm.
And that's the first place of contact. Plus the fact that when we think about bacteria, people think about infection, but it's not. Most of them are commensals, or as many people say, symbionts, because we did evolve with them and they help process the food, they help break it down. They provide very important things like the nitrate reducing bacteria, break down the nitrates in your green food into nitrites. So when you swallow that in the stomach, it becomes nitric oxide. You reabsorb it. And nitric oxide, I think everyone knows about nitric oxide. It's the ads for Beats and everything, and
Right.
all those companies, because nitric oxide is one of your major defense mechanisms, also within the mouth. And your salivary glands reconcentrate the nitric oxide from your blood to 10 times higher to go into mouth, where it's utilized with your friendly bacteria, which are also forms of strep, to kill the bad bacteria.
And it's a constant combat zone between different species of bacteria and different fungi and archaea and
Yeah, yeah.
parasites and whatnot.
Uh,
And they're all trying to keep each other in check, and certain ones can overgrow and cause certain conditions and whatnot. And then, to your point, it connects to the gut and the immune system.
It's usually only goes one direction,
Hmm.
usually, from the mouth out the other
Right.
way. It normally only goes one direction, but it changes because of diet. And sadly, we have had this increase in non-communicable diseases, chronic disease, that many people have shown in a lot of association studies very related to, highly processed foods, right?
Hmm.
And added sugars and all the added preservatives and the dyes and everything else that are absolutely affecting the oral microbiome. And what we do every day changes that oral microbiome. And if it gets dysbiotic with too high of a concentration of the pathogens, you end up having systemic inflammation because
Hmm.
inflammation doesn't stay in just one spot. It goes throughout the entire body, and that systemic inflammation contributes and helps initiate and contribute to a number of other diseases, which is now well documented in the literature.
So let's hit on that real quick. What are we seeing in the literature about the oral bacteria and chronic inflammation and chronic conditions in other parts of the body?
Well,
And
I'll give
and I guess basically to that question and point, how do they get systemic?
Well, I tell you, it's really fascinating. They can get systemic in two different ways. One of which we just swallow it. And here, this is so funny to me because we have had all these concepts in our minds that have been like inviolate for a long time. Like, the stomach acid kills the bacteria. Guess
Hmm.
what? It doesn't at all. In fact, there's hundreds of oral bacteria that survive going through the stomach acid, and they get into the intestines, and they can help create situations that lead to irritable bowel syndrome and also Crohn's disease, IBD, and that's well documented now too in the literature. They end up being a significant component of it, but they also get into the bloodstream because you have a rich blood supply and some of these bacteria, which I think a lot of your audience will recognize the names like Porphyromonas gingivalis,
Hmm.
they become famous because it breaks down tight junctions everywhere.
Yeah.
It breaks down tight junctions in the mouth, in the gut, the blood-brain barrier. It breaks down tight junctions. It breaks down tight junctions between endothelial cells and the arteries, and it releases a enzyme that breaks down proteins, protease, called gingipain, that they have found, for instance, in the autopsies of patients with Alzheimer's. Gingipain is strongly there. And gingipain, that enzyme, breaks down your insulin receptors in your muscles and also has been definitely shown to cause insulin resistance. So let me tell you one little quick study there. It's a famous study done like 20 years ago, 15, 20 years ago. A one-time lavaging of the mouth with Porphyromonas gingivalis in this animal study caused the oral microbiome to change, the gut microbiome to change, tight junctions to break. They documented all this really well. It ended up in the intestines, in the liver, in the pancreas.
Wow. And that's been associated with, as you mentioned, Alzheimer's. There was one study that showed 9 out of 10 Alzheimer's patients had that particular bacteria in their plaques, as well as it's been
Hmm.
associated with pancreatic cancer,
Hmm.
uh, colorectal, a bunch of them.
Yeah, and Fusobacterium nucleatum, especially with the
Right.
colorectal, and stillbirths.
Oh, wow.
That's why you have that relationship. If you have a history of stillbirth, that's 86% more likely to have a history of dementia later.
Wow.
Which a lot of people are unaware of those correlations. And again, you have to be careful because sometimes they're just, like we had mentioned, correlations and associations and epidemiological studies. But don't get me going on that because I have my strong feelings because whenever we start showing these great association studies, somebody will say like, well, that's just an association. And then you said, yeah, you remind me of the tobacco industry saying it was smoking was just associated with lung cancer, but no direct proof it actually caused the lung cancer.
Well, and you bring up an important point because as a pathologist, when I look at those tissues and we can stain and identify a bacteria within the tissue, then you have to scratch your head and say, okay, what are the chronic illnesses in this patient that allowed this into circulation and allowed this to land in the tumor? And many
Hmm.
tumors do have, very distinct bacteria
Yep.
microenvironments within them that are, very signature to those different cancers.
Absolutely. Like you mentioned, there's some famous studies like the Deborah Nejman study of 2020 and so on, where specific tumors have specific microbiomes. And not only that, but you know from the research that the microbiome, the type of bacteria that is in that tumor, helps determine how effective treatment is too. They can give you the prognosis because certain bacteria break down chemotherapeutic agents. 5-fluorouracil is broken down by a string of E. coli.
Mm,
And one of the reasons that 5-fluorouracil works is it's also antimicrobial, and it would kill the Fusobacterium nucleatum animalis, which I don't want to get stuck in the weeds of all the terms,
sure.
but it's very sensitive to 5-fluorouracil. So we have all this wonderful stuff because the oral cavity is also the programmer. And then we have the airway portion of it
Mhm.
too, because if you have airway issues and you're mouth breathing, you change the oral microbiome. And it's also circadian because of it changes, you know, from food, mouth breathing, time of day, salivation rate, medication, over 1,400 medications can give you a dry mouth effect. So yeah, you know what? Someone threw up something there like, we've been around for millions of years. Why do we have these problems now? Well, certain of these bacteria have only been in mankind for about 32 to 35,000 years. Are zoonotic.
Mm.
And of course, we had a big increase in them in the Neolithic period of time too, when we started to go more to agriculture. That changed our diet from the paleo diet to the Neolithic diet. And then more
Absolutely.
recently, and this is something I'm sure you've seen all the time, Dr. Cole, is all the literature on what happens when people go to the Western diet or the
Hmm.
modern American diet
Yeah. I
and
call it the
so forth.
sad diet, the
The
standard
sad
American diet. Yeah.
standard American.
Yeah. And so I mean our audience is going to wonder, we're not saying that brushing your teeth is going to cure all these diseases per se,
No.
but we are saying that this ecosystem does play a critical role in overall health. And so I know we're going to get to some, solution-oriented answers towards the end of our chat here. But so stay tuned, folks. We are going to not leave you hanging. I think there's some important things that we can do. So you brought up this modern era, our Neolithic versus Paleolithic, and now we can call it, synthetilithic almost, and how we live. You have a great paper that's out there on microplastics and nanoplastics within, the environment and what we're being exposed to now. So, I mean, what are some of the biggest modern factors
Oh,
that
well,
we?
we're really exposed in dentistry now too because we're using a lot more plastics, than we used to. We were always worried about silver, amalgam, and the mercury release. Now we have to worry about the plastics coming and the microplastics coming from the plastic, the resin-based composites. And, I always think, I go back to the 70s and I think, wow, gold wasn't such a bad idea. We always talk about how ceramics and gold really was not such a bad idea.
Yeah.
And so, yeah, someone brought up something about human mouth is worse than a dog mouth, but you know that some of those bacteria actually go back and forth. But dog owners can actually have some very similar microbiomes. They give some of the bacteria from them to their dog, and that's actually where Porphyromonas gingivalis jumped to mankind. It was from a dog bacteria, Porphyromonas gali, and they shared some genetic material. So that happened about 35 KYA,
Uh-huh.
35,000 years ago.
Sitting around a
So
campfire somewhere, a wolf came
sharing
up
food,
and
yeah, we will hunt
yeah.
together. We would share the food. Of course, people back then didn't really get concerned about, gnawing a little bit and sharing it with their dog and gnawing again. And so anyway, the one of the major things is like when we talk about this being the gateway microbiome is that they are so it's such a strong thing to keep in mind that we have gateway microbiomes, the oral being a gateway microbiome, the nasal being a gateway microbiome. I think I shared with you that we did the first whole genome deep sequencing of the nose microbiome, and that's when we found over 2,500 different types of microorganisms. And interestingly enough, one of those from that study that we did on the nasal gateway microbiome, We found the bacteria that, as of a couple of weeks ago, they've been talking about so much, the Dullosidogranulin pigrum, which is the one that protects you from long COVID.
Huh.
That
Fascinating.
was out of that study that we published a couple years ago. And we did not look at long COVID with it, but other people have. And so a lot of these bacteria that are in the nose, some of them overlap with the mouth. They're probiotic for the mouth and the nose.
Hmm.
And if you actually were to take your hand and place it over your face like this, that area between your nose, mouth, and the skin has a particular niche of bacteria. And if you upset that niche, you end up with a lot of things like acne
Hmm.
and all sorts of skin issues. So I was at an integrative dermatology conference, and they were talking about the importance of the oral microbiome on the skin, which now we now know the kids who have severe acne have a disturbed oral microbiome also.
Interesting.
There's
Yeah.
over
I,
28
huh.
systemic connections to the mouth. Some people say 53. I think they're stretching it.
I noticed that some of those acne bacteria can live in the mouth. Yeah,
Hmm.
like you mentioned, and so some of the common ones that do inflame the follicles on the face can actually hide out in the mouth, and that's
Which brings up the maternal child initiative, which
there we
is
go.
the
Yeah.
mother child initiative, because the third important gateway is the placental gateway.
Mm-hmm.
Now, I know that some people are going to say it's a little controversial, but I have been to the debate on that was held in 2017 at the Karolinska Institute at the Nobel Assembly. I was there. And quite frankly, they're nitpicking. I mean, they're saying there's contaminants in some of the sampling and so on, but they're not contaminants you would ever find normally in that. I mean, it was very interesting. But most of the research shows that the placenta is also a gateway. It's a barrier. And the vast majority of the research shows that when there are pregnancy adverse effects, that there's a change in the oral microbiome. And in fact, there's a specific oral microbiome set of bacteria that is associated with miscarriages, another one strongly associated with stillbirths. And so, knowing that, and knowing how many millions of miscarriages there are every year, many, many millions, um, that's why we are trying hard to start having everyone cognizant that the first 1,000 days of life are the most important
In terms of like the oral biome developing.
of life.
Mm-hmm.
And
Altogether,
we
because the
know
out,
that from
yeah.
all those great epidemiological studies that they have done, where they have looked at kids who were born during times of sugar rationing, like during World War II, and they are much healthier for the rest of their life. I mean, this is from 1939 to 1954.
Mm-hmm.
Far less issues with cardiovascular and metabolic disease, diabetes, and all that. We now know that that's associated also with oral health. Famous studies out of Denmark, the Nygaard studies, that kids who get a lot of cavities by age 2, 3, 4 years of age are much more likely to have metabolic disease, diabetes, prediabetes, followed by cardiovascular disease. And if you put the hazard ratios in perspective, it's very interesting because it's there. If you have early oral disease, your risk factor is twice the height, twice the amount of what cholesterol is. And we don't talk about it.
No, we don't. We talk about pharma's pills, this, that, and the
Yeah,
other.
we're talking about statins all the time, but they don't ever bring up the fact that there is a strong influence of that oral microbiome. And that's why what we're trying to do is start early care during prenatal, um, And it's a simple supplementation. I don't know if you're familiar with the PPAX trials. In Malawi, they had 10,000 pregnancies and they separated them randomly, and half received xylitol gum and half did not. And the ones that got the xylitol chewing gum, which cost about 8 to 10 cents a day, had a much lower rate of miscarriages, had a much lower rate of low birth weight infants, and a much lower rate of infant demise.
And help people understand, what xylitol is and where it comes from, because it's natural. So when people hear, an unfamiliar chemical term, they may think, oh, that's just one more supplement or one more chemical. No, we see xylitol in nature a fair amount.
Mhm.
So help people understand what xylitol is and why it would have an effect on balancing out the oral biome and preventing these diseases.
Well, it's very interesting because xylitol, you have about 15 grams on average in your liver because
Hmm.
xylitol is produced from high levels of glucose. It's one of the ways that high blood sugar is converted not just to glycogen, but also there's a pathway which they'll take you back to biochem days,
Hmm.
your pentose phosphate pathway, which takes it and takes high levels of xylitol and makes high levels of blood glucose and makes xylitol out of it. And if it gets really bad, you make a lot of erythritol. But that level is you're a bad diabetic when you start doing that. That's
Sure.
associated with diabetic retinopathy and everything. And I saw someone in the chat bring up xylitol and myocardial infarcts. That's not what the Cleveland Clinic article actually said.
Hmm.
That's what the headlines said in like CNN and so on, but
Right.
not what the article actually said. That study from the Cleveland Clinic, Stanley Hazen's group, they looked at individuals with cardiometabolic disease. And in those individuals, the top third that had the worst outcomes also had higher levels of xylitol in the blood. But that xylitol was all endogenous. That's your body xylitol. And that was to be expected because
Sure.
these people were also diabetics.
Sure. Exactly.
So
Exactly.
that's a situation where the association is not really there. It's
Right.
just, yeah, it's just common sense biochemistry. And they even go to the point of saying this has no effect whatsoever on the xylitol that you use for dental products. I mean, they even say that in the article, but that's not what the headlines were because, as you know, headlines tend to be really dramatic. They want people to read it and stop doing what they're doing and call their friends and tell them all that good stuff. But going back to the first 1,000 days, again, we're just trying to get this to be done through a lot of the public health programs because the fact that in like the state of Texas, 50% of all the babies born are under Medicaid.
Hmm.
Most states it's about 40%. And this is a population that really needs to have all the additional aid you can. And that xylitol gum also reduces gum disease in all the mothers. And then they don't pass on these bad bacteria either. Now, this is a very important thing. Um, there is a bacteria called Streptococcus mutans.
Hmm.
Strep mutans, every dentist, every hygienist knows about because it's one of the top people that are associated with it's one of the top bacteria associated with um, cavities. You know, strep mutans, strep sobrinus are the big cavity producing ones. But it's also associated with oral cancer
Hmm.
and strokes.
Well,
And people don't realize that strep mutans is the same bacteria that produces cavities, also can invade your endothelial cells, has been demonstrated to live within endothelial cells that lining your arteries of the heart, and has been shown to be part of what is the group of bacteria affects pregnancy overall. So, this is why we have to work against strep mutans. It's just the canary in the coal mine letting us know that there is a major issue with your microbiome. So, anyway, it's really important for us to understand that there is these strong associations between strep mutans and cancer, oral cancer, and strokes. And this is all well documented and found in well published literature. So that's something why we're working on it very strongly to get people to understand how important that first 1,000 days is. Now, the research on this shows that if you have a healthy baby and they have a healthy oral microbiome, they stay healthy. And
Yeah,
not just the research goes up to 19 years, and then the studies had to end because it became adults. But overall health shows it continues apparently for the rest of your life.
amazing.
You
Yeah,
cannot beat that.
and that's
Being
where xylitol kills that particular bacteria, amongst others, and shifts the
amongst
ratio in the
others.
mouth. And I've seen some case studies where patients with reasonably severe cavities have reversed their cavities with just xylitol.
Oh yeah.
Correct me if I'm wrong there,
Nope,
but
nope, you're right.
yeah.
In fact, they'll actually arrest them with a xylitol gum. It's kind of funny that has been shown and documented that xylitol gum will arrest cavities, and we have a hard time getting people to do it because with the original research coming out with miscarriage and the low birth weight babies and the effect of xylitol gum, there's a lot of people who just didn't believe it. And so that was kind of odd because they just didn't believe it. It was like too easy of a solution and too inexpensive when we really need to have something far more expensive. But see, it's just not that. And this is what's really important is that xylitol inhibits the bacteria that produces gum disease too. And we mentioned Porphyromonas gingivalis and Fusobacterium nucleatum when it comes to cancer and Alzheimer's. Okay.
Hmm.
Xylitol inhibits both of those too.
I'll be darned. Yeah. And I mean, it's almost as easy as, going back to what Semmelweis did at the Allgemeinen Krankenhaus in Hungary, Austria, just saying,
Hmm.
guys, if we wash our hands with soap, we tend to kill less mothers and babies. Simple as that. And
It's
it's this
it's that simple, and
simple.
it's because xylitol can't be metabolized by these bacteria. The bacteria will pick them up and they attempt to metabolize and use the energy, and they can't. And it messes up their ability to actually form that sticky plaque, that biofilm.
Hmm.
And also, it prevents them from releasing a lot of their pro-inflammatory, the pro-inflammation products that they produce. And of course, one of the key things is it keeps the bacteria from protecting themselves because bacteria actually produce glutathione
Hmm.
and cancer cells, which is where the xylitol in cancer comes in. Because when you use syngeneic mice models, which is using mice with the appropriate cancer, and you use xylitol, those cancer cell lines, like with malignant melanoma for one, they can't protect themselves by producing glutathione to protect themselves from the reactive oxidative species, the ROS, that the body produces, your T killer cells produce to get rid of the cancer.
And is that because they're looking for a six carbon sugar instead of a five carbon sugar for energy, basically? Is that part of the?
They can utilize some five carbons
Mhm.
themselves, pentoses, but not the way it's shaped. It's not shaped correctly. It'll go
Got it.
through the glucose pore. Someone asked a question, is glutathione good? Absolutely. It's an antioxidant.
Hmm.
Okay. And so that's great, but antioxidants also protect cancer cells
Right.
because they are sensitive to ROS, to the reactive oxidative species. So it's a dual-edged sword. And that's kind of a funny thing because there was that famous study out of Taiwan with colorectal cancer. And they had done heavy doses of supplementation with NAC, N-acetylcysteine, and it actually increased the rate of colorectal cancer.
Yeah.
But as we know, anti-inflammatories do that. Yeah.
Yeah, I mean that goes back to most of medicine, unfortunately. People think if a little is good, a lot is better, and that Goldilocks effect, you're trying you hit biphasic curves where, at this it's not enough, but once you hit that peak, now you're at the right range. But if you go beyond, you actually get that negative effect. So just because a little bit of something's good doesn't mean a lot of it's better. I mean, to that point, are there contraindications in certain patients, to use xylitol or, any medication interactions or things like that that they should
No,
be
there's
aware of per
none.
se?
No, it's a naturally produced a product that is part of our mitochondrial history because um, there's actually a story behind it. It's the marine isotope era 6, where we ate a lot of tubers, and the tubers are loaded with D-xylose, and we had to break down the D-xylose, and we have xylitol dehydrogenase now in our mitochondria. We evolved to be able to do xylitol. Dogs did not.
Uh-huh.
Okay, so
So
and
if your dog gets it, they'll get diarrhea.
yeah, they can get sick, but yet the original studies on safety, some of them were done on beagles, and the beagles did just fine. So it must be kind of species or
Huh.
strain, yeah, significance in there some way. But we have all these problems that have happened because the fact that we've had these shifts in our oral microbiome is nowhere near as healthy as it used to be. I'm sure all your listeners have heard that we're missing about 20 some odd percent of our good bacteria from what we used to have as hunter-gatherers. I mean, that's pretty much well published. And it's the same in the mouth. We're missing a lot of good bacteria, and every day we're making it worse
Right.
because we're using all these antimicrobials.
Well,
And
and
there's that
yeah,
famous
go ahead.
studies on that.
Yeah, I mean, to some of the alcohol-based mouthwashes, we're wiping out a bunch. With some of the foods we eat, glyphosate, paraquat, atrazine,
Hmm.
those are all literally patented. Glyphosate is patented as an antibiotic, so it's killing the moment your some of your breads or your unfortunately oatmeal or hummus are two of the highest foods in it, hit your mouth, you're starting to kill off some of your good bacteria with the food you're eating.
Hmm. And then just things like Listerine,
Hmm.
Listerine blue, what's it, blue mint, cool mint, whatever. The Prego study is the one that just was published about a year ago. And what they showed is that long-term use of Listerine actually increases the number of bad bacteria you have.
Wow. And so, I mean, for the folks listening, there are xylitol washes that one can use, xylitol toothpastes. And I want to sidetrack real quick because, in the news is the controversy around fluoride. And so, that's been in the zeitgeist for eons that, oh gosh, fluoride is the best thing for oral health, when really, xylitol does a whole lot better for the teeth and the oral biome.
Well, yeah, because really fluoride was not ever meant to work with the microbiome. I mean, to get any type of antimicrobial amount, you have to use a very high concentration of fluoride. And then, of course, stannous fluoride also will have an antimicrobial effect. But you're killing the good guys too, which is why we have to go back to the effects. There's that famous San Juan overweight adult longitudinal study, and they actually showed that people who were using these antimicrobial mouth rinses were far more likely to become pre-diabetic, diabetic. They weighed more, and they had an average waist size that was over 3 times bigger than those who did not.
Wow.
So
Wow.
all these things have an effect. And it's in fact just recently there was that chlorhexidine
Mm-hmm.
mouthwash, was a lot of dentists use. They have to give you a script for chlorhexidine, but using the chlorhexidine for 10 days changed the gut microbiome
Mm-hmm.
because the gut actually theoretically starts at the lips. And so if you sterilize here and you kill off all these good bacteria like the nitrate reducing bacteria, and one of my papers from years ago, you kill your gluten metabolizing bacteria that
Mm-hmm.
break down your gluten because the
Interesting.
whole Rothia genus breaks down gluten in your mouth.
Huh.
So we've had this big increase in gluten sensitivity. I'm not talking about celiac disease. I'm just talking about gluten sensitivity.
Sure.
So we've had this big increase that has occurred because of the killing off the good bacteria that actually, which is why if you go to Italy,
Yeah.
you can eat all that stuff because they do a couple, or if you buy Italian pasta, and I always show it to people, look at the cover of the Italian pasta. It says, you know, bronze drawn and cut and slow dried. And what that does is it creates the proper microbiome in your pasta so you can digest it easier.
Huh.
And that's why
Fascinating.
bread made on stone, because stone has a microbiome. I
Uh-huh.
did all that research. I actually went to Great Harvest. We actually sampled all the stuff for cutting up all the wheat, and the air was full of gluten metabolizers. And we
Huh.
would jokingly tell people, if you have a gluten sensitivity issue, just go sit at a Great Harvest and sit there for a little bit and breathe in all those gluten metabolizers, like Rathia area, which is airbound, and you'll be able to have all the gluten you want. But no, that's not true for celiac disease. Okay, but I
Right.
mean, if you just have gluten sensitivity and all that. So going back to all these bacteria, like the Rathia, they're immune signaler. They signal throughout the body. Well, someone brought up again, what is Great Harvest? That is a chain where they make their own flour. Everything's made from grain, and it's usually organic, non-GMO, type grain. They grind it. In fact, we used to have a bakery not far from the hospital that was called the Austrian Bakery, and he was Austrian, and he brought in all his own wheat from Austria. He had bags of it because he would not use American wheat.
Uh-huh. Yeah.
and
Yeah.
and they don't believe in using some of those preservatives like calcium propionate. And someone brought up autism. Well, some of the greatest research done on autism showed the role of calcium propionate, which is a preservative in bread, and that calcium propionate is also antimicrobial. That's why
And
they put it in bread.
yeah, and in autism, we've seen obviously a shift in the oral biome,
Hmm.
and it is understudied, but in some of the smaller case series, it's been fascinating how like some of the children that were nonverbal shifting the oral microbiome. What was that? Like 6 out of 20 kids in that one study became
Well, we're
verbal.
actually talking about one of my studies.
Yeah, that was one of yours. Yeah, and
Yeah,
and don't worry, folks. We'll link some of Dr. Cannon's papers on the website.
yeah,
I
that
mean,
was.
he's obviously very well researched and just amazing information that he's put out there.
Well, we really did not expect to find that as a finding, by the way. We
Uh-huh.
were not at least bit prepared. We had 30 kids with autism that were severe autistics. We had children, 30 very healthy kids from the United States, which was very difficult to find.
Sure.
Very difficult to find 30 healthy kids. And then we had 30 kids from a blue zone in Colombia. I went to an area that was controlled originally by the FARC, and before that, Pablo Escobar, and it was a blue zone. Everyone's very, very healthy because they had no junk food. Okay, no one builds a McDonald's in an area with communist narco terrorists, right? It's not good business model.
Right.
And so, anyway, we were really surprised. We did intervene with xylitol, which is a prebiotic, and then with a probiotic. And we haven't really talked about probiotics, and we need to. And we found an improvement in the verbal skills of 9 of the kids in the group of the with autism, which we did not expect. In fact, a couple of them I could barely even. They acted so different, and they were. I mean, that is also shown in other studies, not just mine.
Uh-huh.
But other studies have demonstrated that, and that's why you find the research coming in from like Italy and other places. And so that's how xylitol works. It inhibits the bad bacteria so you can have a shift from that dysbiosis to a eubiosis using something that is natural. And
Sure.
hydrogen peroxide overall is not bad. It kills mostly the anaerobes. There's actually companies that make hydrogen peroxide that stabilize and they add zinc to it,
Uh-huh.
and that is a very effective product and so forth. But just hydrogen peroxide itself is not stable,
Right.
right? You open up the bottle
Right.
and it doesn't last very long whatsoever. And so, some of the things that I really like to talk about, the fact that, when you talk about xylitol, I don't mean just to go back to that, but it's available in gums, candies, gummies, toothpaste, on floss. You can get mouthwash with xylitol. We're looking at xylitol for oral mucositis for patients,
Hmm.
oncology patients, because it's been shown to inhibit those bad bacteria and help with healing. It's also an anti-inflammatory, like you mentioned before, because it carries calcium. It
Uh-huh.
actually can remineralize teeth. So overall, and when you see negative stuff about it, it's almost like that's a campaign.
Uh-huh.
I
Yeah.
hate to say this, but it's like dealing with AI. I look up something on AI, I ask ChatGPT, I get more misinformation. I'm not talking about hallucinations.
Right.
I'm telling you that people are out there absolutely trying to influence opinions. And one of the best presentations I've ever heard, she was a whistleblower who had testified in front of Congress from a marketing firm, a major one, and their big clients were R.J. Reynolds, tobacco industry, and then the food industry when tobacco went and bought up the food.
Sure.
They did everything they could to influence opinion. That back in the day, they had articles they were putting in everywhere. And yeah, by the way, with the xylitol and the pets, don't forget it's the same thing with chocolate and everything else like that too.
Right.
And as electric toothbrushes, there's better ones on the market than others. Supermouth makes a really great one. And also, as someone has about plain old hydrogen peroxide, careful. A lot of those are very acidic. That's how they preserve it.
Mm-hmm.
So the acid could be damaging your enamel. So you want to make sure you just test it yourself. Go on Amazon, whatever, get yourself a little pH dipsticks and then see what the pH is. If it's bad, if it's acidic, don't use it because you'll be destroying your enamel. Now that I got completely off the subject from all those
That's
pop-ups I
okay.
see
That's
all the
okay.
time,
I
just
know
block
it's
those
fun.
guys. They're
Yeah, no,
just
we'll have 10 minutes of Q&A here at the end, but and then the other one I wanted to mention at the end, you were going over the list of the different forms of xylitol nasal spray as well.
oh yes.
Um, which I bet, I've got a cold after some travels here, and so I've been doing xylitol every day just to stabilize the cold as I'm on the mend. But xylitol can balance the nasal biome as well as the oral biome.
Yep. Oh, and the other thing um, we got to talk about on this is the importance of Salivaomics because that's something that's very political right now. And when people hear how political the Salivaomics situation is, it is insane. And this has got to stop on the political side. And it's all about money.
Mm-hmm.
But Salivaomics is using saliva for diagnosis. And I sent Dr. Cole some of the information on this,
Mm-hmm.
but saliva has over, take a wild guess out there, there's 500 some odd people out there, 528, which have a prize to the person guess how many biomarkers are in saliva. Over 15,000
Yeah.
biomarkers.
Amazing.
You
Amazing.
can look at over 201 diseases off of saliva. Now you say, of course you're excited about that. You've been dealing with saliva all your life. But no, here's the reason why it's so exciting. Saliva is better than blood for diagnosis. People don't realize that. It actually has more markers. It is more stable. What we want to see is you as an individual, like Martha right here talking about setting up her garden, to be able to spit in a tube, seal it, send it off, and get back a test result. And that would be shared with your physician, and you would be, it would be life saving,
Hmm.
especially in areas which don't have health care. And I spent time a year in East Tennessee,
Mm-hmm.
and there's people who don't have access. The vast majority of you can get yourself to a physician. There's people out there who really have a hard time doing it.
Sure.
There are people who are against that because they don't think that you should be able to make the decision to spit in a tube on your own.
Oh dear.
How dare you? You should have their permission to spit in a tube. And David Wong back in 2008 came up with Salivaomics because the omics means you can run. Yeah, some of you are really good at spitting, I can tell. But and you could just go ahead and get early diagnosis for everything because I have to tell you, like with Alzheimer's, early diagnosis makes a huge difference.
Absolutely.
Yeah, it makes a huge
Absolutely.
difference. And yet, there's a lot of people out there who, especially with the big pharmacies, who
Hmm.
actually want you have to go into a pharmacist and pay a lot more money to have it done than have it be shipped directly to you for you to, drawing your own blood is a little bit more difficult.
Sure.
But spitting in a tube is not, and that's one of the things I definitely want to bring up and how very important that is. That hopefully, if you start hearing anything about Salivaomics, you'll be backing us 100% when it comes to taking care of that. And again, with the kids, if you get the kids in early and you get them to spit in the tube and you can see what they have, all the studies have shown you can prevent the decay if you know omics. You are very close. How spelled Salivaomics? You're very, very close.
Hmm.
Salivaomics is
Hmm. Yeah.
OMICS. I'm sorry, OMICS. I'm Phillips Braun. They're all going to be pretty much the same. I mean, that's
Sure.
something you go to Costco for, right?
Sure.
So going back to all this, if you can discern up early who has which issues, who has the bad Fusobacterium nucleatum, who has a bad Porphyromonas gingivalis, we're saving minds. We're
Hmm.
saving hearts. I mean, I don't want to overplay it because there's other contributors, right? I don't want to
Certainly.
overplay it. But because I know we're running out of time, let me tell you one very important thing.
Sure.
It's from, the National Health and Nutrition Examination Surveys, NHANES. And they looked at over 50,000 individuals who had said yes to the use of probiotic or a symbiotic, which is a probiotic and prebiotic combined. You want to take a wild guess, Dr. Cole, at the difference in the hazard ratios for cardiovascular disease?
Probably huge.
Yeah, half.
Yeah.
And this was presented at a meeting in Rome I was at. Everyone in Europe knows how important a microbiome is. Physicians there recommend a good probiotic. You get it you'd see Dr. Cole, and Dr. Cole said, well, use this brand, use this brand. What you need is this one for this issue. That's what they do in
Uh-huh.
like Italy. And the Italians were laughing about the fact that the research was done in the United States, published by a bunch of Chinese professors. Um, and the major thrust of it was being talked about in Europe. And it boils down to an increase of quality of life years of 10 to 12 years of quality of life years. Raise your hand if you don't want to have additional 10 to 12 years
Yeah.
of quality life.
Isn't that
I
amazing?
only see a few hands up.
Yeah, just at the gateway to the body, the mouth, you can
Yep.
change your long-term health outcomes. So, I mean, to that point, what are some of the basic things, if we were to boil it down, you know, for simplicity's sake, and then we'll jump into Q&A here in a minute. What would be the top things you would recommend to for people to take away to optimize their oral microbiome for health?
Oh, I have to respond to a chat that came up there
Sure,
that
sure,
said
go
my
ahead.
79-year-old hand won't go up for that. Oh, 10 to 12 years? Listen, my wife's grandmother lived to 105, and her mother is 96 years old.
It goes back to my old joke in medicine. My patients would ask, and I would say, "You want to know the secret to a good long life?" And they would always say yes. And I would say, "Choose your ancestors well."
I like that. That's absolutely true. Okay, now go back to your question again because I
Okay.
forgot.
What are the top things folks could do to optimize their oral microbiome health so that they can get some of these long-term benefits and avoid some of these chronic diseases?
Okay, well, first of all, you check the big ones. Number one is airway.
Hmm.
Now, my younger brother passed away at the age of 59 from sleep apnea.
Mm. So sorry.
It caused a major cardiac event in the middle of the night, and he had been told he had sleep apnea. He had numerous apparent life-threatening events as he was sleeping during the sleep study, but his insurance denied the CPAP, and I did not know.
Hmm.
He never mentioned anything to me. And then I get the phone call that he's in ICU, and he ended up not surviving. And it was a very tough time. I take care of his son, who's special needs.
Hmm.
Um, I will probably be doing that forever, I
Wow.
guess. But airways, very important. Diet, I hate to say it, and of course, stay away from processed foods. I
Absolutely.
try not to eat that, but Dr. Cole, you were just traveling. You know, when you go through an airport, everything's processed,
Yeah.
100%. Respect your microbiome. Stay away from the antimicrobials. Try to avoid all the preservatives like calcium propionate.
Hmm.
That is a very strong antimicrobial. When I started in practice, I used a lot of Listerine. I was making myself very unhealthy.
Sure.
Heck, I gave out a lot of Listerine, but you know what? We didn't know any better back then.
Right. Right.
And the one thing I have understood is that you're never right about everything. Just ask my wife. And you will end up, making mistakes, and you have to learn from mistakes and move on. And one is we have to respect what is good. Yeah, CPAP's very tough to tolerate. Statistically, only 50% of people can really do well with a CPAP. The
Right.
oral appliances have a much higher success rate,
Sure.
but they have to be done correctly, which requires seeing someone who really specializes just in that. Probiotics. Uh, we have a hard time with probiotics because a lot of them we don't know which ones are the right ones to use. I
Sure.
would go look at the ones. Someone mentioned Lactobacillus rhodori.
Uh-huh.
Rhodori has tons of research on it. I
Yeah.
mean, they have like over, I think it's something like 1,200 articles altogether and 200 trials.
Yeah. I ferment my own at home. I do that one.
Oh yeah, yeah, man. So that's a very good one. BioGaia is another good company that was first started by Jeff Hillman, a famous researcher from
Hmm.
Harvard, worked with Sigmund Sokransky and others. So yeah, probiotics. The prebiotics, xylitol is an easy one to do. And I've been, talking a lot about xylitol now ever since I went to a meeting in 1984, and it was a major dental meeting. And in 1984, the American Dental Association said they were going to go ahead and really switch to xylitol a lot and xylitol gum. The people out of the University of Minnesota were talking about it. Everyone,
Uh-huh.
the dean there was switching the school to xylitol. I don't know what happened, but
Yeah. Big,
the other thing is there are no such things as coincidences all
big
the
fluoride
time.
swooped in. Yeah. Some of the big
They
industries
swooped
swooped
in.
in.
Yeah.
Well, what about mastic gum? I know I haven't seen anybody bring up mastic. I know there's some studies on the terpenes in mastic gums that will are also, anti-cancer agents as well. Have you gone down the rabbit hole of mastic gums at all?
Actually, you know what? The first gum used was used at least 10,000 years ago
Yeah.
because
Uh-huh.
they found that in Scandinavia that there was human DNA imprinted into tar, the pitch that came out of trees. They still use that same pitch in Russia.
Uh-huh. Yeah.
Yeah, because when I've been there lecturing in the past, you just got from Siberia cedar pitch. Oh, wonderful!
There you go.
There we go. And I'm sure Siberia is definitely non-GMO.
Right. Right. And I mean, that's a good point you bring up is even like going back to the xylitols, like a lot of the xylitol gums are made in China because they don't grow GMO corn there. And so the xylitol is derived from corn cobs. You can
Hmm.
get it from birch bark. I mean, in small amounts, it's present in what, raspberries, plums, blueberries, pumpkin, mushrooms, lettuce, spinach, but that's in small amounts. But the ones we derive for, public usage from gums and toothpaste and whatnot, generally that's from non-GMO corn.
Yep, yep, from the corn cob itself. Yeah, it used to be from the sugar cane,
Yeah,
from the bagasse
yeah,
from the sugar cane. They would just crush up and use that. And so, yeah, that's all very, very natural way of making yourself healthier for sure. And then, of course, limit the amount of carbohydrates you consume because the
absolutely.
human body was never meant to consume all the carbs. I see, like, I just faint every time I see my grandkids eat all the sugar that they have eaten, and it's actually a lot more than I ever ate when I was young.
Certainly. Well, I
Uh,
see Autumn has popped in. I know you've been great about answering so many questions. You're just a fountain of information. But Autumn has some more that she's distilled from the audience here. So she's gonna rapid fire a couple at you, Dr. Cannon, and let's see how we can answer some of the audience's questions here. And this has been
Yes.
amazing. This has been, I mean, you're a wealth of information, really.
well, thank you very much. I appreciate that.
Go ahead, Autumn.
All right. Well, I'll just jump right into our questions because we have a lot of them. We actually have gotten a lot of questions on this, but an anonymous attendee asked, what is the name of the test that checks for the microbiome health in your mouth? What is that test, the name of it?
Okay, well, right now, you can only order those big saliva tests that look for everything. You can only order that for research purposes,
Hmm.
like Saliva Direct and so forth. However, if you want to just look at the bacteria, and I don't want to go heavily into brand names, but there's one company that is out there big for the whole genome where they look at all the bacteria in your mouth, and that's called Bristle.
Hmm.
And they do whole genome sequencing where they look at all the different bacteria. They'll tell you if you have too many bad and not enough good. It's called Bristle. I actually did a research study with them on that one article I sent you with the kids with epidermolysis bullosa because
Yeah.
I've spent a lot of my life treating kids that, as a friend of mine said, no one else wants to see
Hmm.
because they would have so many severe medical disabilities that they would just say, no, not Bristol, like bristle, like a bristle on a
Like a
toothbrush.
toothbrush bristle.
Yeah,
Yeah.
not like a Bristol, a town.
Mhm.
Um, and then there's other companies out there that are very strongly looking just for the pathogens.
Mhm.
And there's Simply Test is one of those companies out there. Well, you spit in the tube, and they'll tell you if you have the bacteria, for instance, or oral DNA is another company that are associated with the Alzheimer's and everything else. You can look at that. And my wife has early onset Alzheimer's, a rapid progressing, and we have bought a lot of time. That's a subject for a
Different.
completely different hour because there are so many exciting things for Alzheimer's that are not covered by Medicare.
Well, we should have you back for another hour and cover some of those because I know you and I have gone down so many of the similar pathways researching that. And you've been very popular with the audience, and a lot of them are like, bring them back. I'm like, we'd be honored to have you back at another point. What else do you have, Autumn?
Another question from Connie. She asked if gum tissues can regrow. Any suggestions for treating receding gums naturally?
Right now, not really. There are peptides that do need more research to be done. In fact, I'm looking at a lot of peptide research. There are some fascinating peptides out there. And I'm excited to see what we can do down the road. But the same thing with something called EV, extracellular vesicles.
Hmm.
With the kids' epidermolysis bullosa, they have a new program where the extracellular vesicles are just like little packages of DNA. They'll actually be absorbed by cells, and they'll tell the cells to grow again. And it'll move them out of senescence.
Mhm.
And so you actually have a regrowth of gum tissue. That's down the road.
Hmm.
Right now, if you do it, you're just being a study of an N of one on yourself. That's an
Certainly.
old story. The N
Certainly.
of one.
Yeah, certainly.
Um,
Exosomes are a type of EV.
Yeah.
Exosomes are a specific type of EVs. EVs, extracellular vesicles, include exosomes. Exosomes are a subset. Someone asked
Right.
that.
Right.
Yeah.
we've also gotten just a lot of questions on what people should be looking for in their toothpaste and mouth washes, like
Oh,
any
there's
specific.
there's a great remineralizing material called TMP, trimethaphosphate. And here's the story behind nano trimethaphosphate. It's better than calcium hydroxyapatite. It's better than calcium glycerophosphate. It is the number one best remineralizing material is nano calcium trimetaphosphate. It has a patent, and the patent's owned by a university in Brazil, which is not a big deal, but no one wants to pay for. Oh, there's dangers of nano. Yeah, like nano titanium dioxide is dangerous, but not nano trimetaphosphate. Okay. And so it's like the old story with L-arginine, arginine bicarbonate, the 8% new Colgate coming out with 8% L-arginine bicarbonate. They're only doing it now because the patent has expired and had been owned by Tom's of Maine.
Right.
So I hate to tell you this, people, but money talks.
Yeah.
And I have to tell you, Olga, don't worry about any nano because it's nano is just a size. It doesn't make anything particularly. It just can make things more effective. And you're right. If it's something bad for you, it can make it worse because if it's bad, it's going to get, yeah, it goes to the brain, cause dementia. But nano trimetaphosphate is just a phosphate that just breaks down in your mouth. It doesn't go to the brain. So anyway, going back to all this, trimetaphosphate is an excellent product. L-arginine is great at remineralization, is better than fluoride at remineralization, it's been published in Journal of Dental Research and other things. But it also probably feeds Porphyromonas gingivalis.
Oh dear. Yeah.
So you don't want that. And so, but with the xylitol, if you combine arginine with xylitol, you don't have to worry about feeding the bad guys. So you have to know what you're doing. And Dr. Cole, you saw we've done some major studies that are published in top journals on how we can affect these pathogens without affecting the good bacteria.
Wonderful.
Well, since we're already at the top of the hour, I'll just ask one more question that is always pretty popular with our audience, and that's on just fluoride, where people have very strong opinions on both ends, but just your opinions on putting it in the public water supply. If you could just walk us through your overall view on fluoride before I move over to our closing announcements.
Yeah, the thing about fluoride is it's really almost more of a religion.
Yeah.
It is almost like you almost have to swear allegiance to fluoride as you walk into a meeting. And it's interesting because with all the work that our research groups have done, where we show, hey, look, we can make a fluoride-free, really good toothpaste that's 100% safe to swallow. If you bring that up, you could actually get in a lot of trouble in some organizations. I mean, I don't know how that happened.
Yeah.
But I guess we have that in healthcare, right?
Yeah. Fluoride, amen. Vaccines, amen. Just all sorts of things.
Yeah,
Amen.
I mean, you're not allowed to question it at all, even though you can show the research and you can say to everybody, hey, let's look at what's being published by the National Toxicology Program and so forth, and keep an open mind. But I was really pleasantly pleased when I heard, and she's from NIH. She was at one of our national meetings, and she said, we're really looking into it with an open mind, 100%. We have people on our panel who feel strongly for, strongly against, and the outcome is what it's going to be. And everyone kind of laughed, going like, yeah, at least half the people are going to be angry.
Right. Right.
No matter what the outcome, right?
My biggest concern. Go ahead. I want to hear what your final conclusion.
Well, the final thing on that is the fact that back they don't do it anymore, but we used to be able to get from the state of Illinois where I was practicing fluoride kits where you could study how much fluoride was in your well water, for instance. And there was people actually in developments who would just send the water in that from their tap, and it varied all over the place, the amount of fluoride.
Sure.
I mean, it was in some of the water, they would be contacted by the state and said, don't drink your water.
Right.
There's too
'Cause
much
it's too
fluoride in
high.
it. You can't drink your water. You have to drink bottled water. And then they stopped doing it maybe about like 30 years ago because the backlash from them telling people you got way too much fluoride. So this is the problem we have with any system like this. And I called up in Minneapolis, a suburb where two of my grandsons are at. I asked them, how much fluoride are you putting in the water? And they go 1.1 parts per million. I said, well, the recommendation is 0.7 parts per million. Why are you putting 1.1? And the person from the water company said that because that's what our local dentist told us to do.
Wow. Wow. My biggest concern with fluoride personally is it competes with iodine. It's in that halide column on the periodic table.
Well, it's an enzyme inhibitor.
Yeah, it inhibits enzymes,
Yeah,
and
it's
then we
enzyme
don't.
inhibitor.
Yeah, and
Yeah,
then we don't
that's
get
actually
so.
one of the ways we actually tracked fluoride into the nucleus of the fibroblasts at Northwestern and doing nuclear magnetic resonance. This is I love going to these conferences and then someone's up there lecturing and they're going like, well, I wish we kind of knew about this and knew more about that. I go, well, just read my article.
All they have to do is listen, and that's the. Yeah, you're right. I mean, and
I
again,
published on that, and you're up there talking
right?
about it, and you haven't even mentioned the publications. So it's that's the key thing. I want to say to everyone, I really appreciate you letting me talk tonight. As you can tell, I'm passionate about it, and I really want everyone to know that treat your microbiome like it's your own.
Mm-hmm. That's a great statement. Great statement, Dr. Cannon. Well
Well,
said.
thank you.
Go ahead.
Thank you so much.
Well, thank you so much, Dr. Cannon, for joining us. And then I just want to let our audience know that we will be posting the articles and the papers that Dr. Cannon has mentioned on our website, along with a recap of this entire episode, because I know they went over a lot of information. So that will be posted to our website tomorrow. But thank you so much, Dr. Cannon, for being here, and Dr. Cole. And I'm going to move over to our closing announcements.
Thank you.
Thank you.
Have a good night, Dr. Cannon. I hope we
Thank you.
get to do this again.
Okay, thank you.
Good night.
All right, so we'll be quick tonight. The first one that I just wanted to bring up tonight is our campaign. Parents and pediatricians need trusted guidance now more than ever. And that's why here at IMA, we are building the Parents First Project, a free searchable childhood health resource center created by independent pediatric experts. The great news is that we are already almost 65% of the way there to our $250 match goal. So every dollar you give is doubled, and you can donate today at imahealth.org/parents. Vitamins matter, but the right forms and doses matter even more. IMA's new free guide, Vitamins 101, breaks down 13 essential vitamins, what they do, where to find them, deficiency signs, and the forms your body can actually use. This is written by IMA Senior Fellow, Dr. Christina Carmen, and it is a clear guide to just guide you for making smarter decisions when it comes to supplements. You can download it today at the link on screen or by scanning the QR code right there. Before we close tonight, we just wanted to share a short video from Children's Health Defense about the importance of signing the COVID Justice Resolution. With COVID accountability back in the national conversation, now is the time to make sure our elected officials hear from the American people. If you haven't signed the resolution yet, you can do so at covidjustice.org. Thank you all so much for being here tonight. Now let's take a look.
The masks, the tests, the forced shutdowns, the school closures, the lockdowns in your home, the experimental toxic injections, the closing of houses of worship.
We were told that every other human being is a vector of disease, and all of our rights went away. We haven't really dealt with the implications of this as a nation.
And that's why Children's Health Defense and many other groups, we are all joined together in something called COVID Justice.
COVID Justice Resolution.
The COVID Justice Resolution is a formal proposal urging the United States Senate to do the following.
Repudiate the most harmful COVID-era emergency policies. Reaffirm that constitutional rights do not disappear in a public health crisis. Establish binding guardrails on future emergency powers and protect bodily autonomy, free speech, religious liberty, and due process. This resolution is about principle. Emergencies do not suspend the Constitution.
We must have a reckoning that at a minimum says that they won't do this again. They won't abrogate the Constitution and everything that we hold dear.
And we have to, because there are many people, very powerful people in high places, including at the World Health Organization, who think we should repeat this all over again if there is another pandemic.
There's a petition at covidjustice.org. We have tens of thousands of signatures already.
You should sign the petition. If you haven't, go to www.covidjustice.org.